Hello, everyone. Welcome back to the Ozul Group Podcast, episode number 3, the podcast where we dive into the real deal on healthcare in the Lone Star State. I'm your host, Rafael Ozul, and today we got a fun yet eye-opening episode for you. We're tackling 5 key questions about health insurance in Texas. Think of it as a quiz to test your knowledge or learn something new. These questions highlight some of the biggest challenges and misconceptions out there, especially since Texas still leads the nation in uninsured rates. We will go through each question one by one. I'll read it out loud with the options, give you a moment to guess, then reveal the correct answer. I will also break down why it's right. Please stick around until the end for a quick tip on the upcoming enrollment periods for 2026. Let's jump in.
Disclaimer: this podcast, hosted by Rafael Ozul, a licensed insurance agent and CEO of Ozul Group LLC in Texas, provides general educational information on broad topics. It is not legal, financial, medical, or insurance advice. Laws and regulations may change, so consult official sources like tdi.texas.gov or medicare.gov, 1-800-MEDICARE, for current details. This is not an offer to sell insurance or a guarantee of coverage. Consultations booked at ozulgroup.com are informational only. Coverage depends on your circumstances, policy terms, and carrier approval. We may earn commissions but aim to provide unbiased information. Listening does not create an agent-client relationship. For Medicare plans, we do not offer every plan in your area. Contact medicare.gov or 1-800-MEDICARE for all options. For personalized advice, consult a qualified professional. Information is based on public sources as of July 2025. Actual impacts may vary. Sources are listed in the YouTube video description.
All right, welcome back. We wanted to make this episode a little bit more interactive, so we actually hit the streets, or rather the outlets, to ask real Texans these same questions. You'll see their guesses and reactions right after each one. We'll go through each question one by one. I'll read it out loud with the options. I'll give you a moment to guess. Then I will play those street responses. And finally, I will reveal the correct answer with the breakdown. So let's start with question number 1, shall we? Question number 1. In Texas, which group is more likely to be uninsured? A, kids under 18. B, young adults 19 to 34. C, adults 35 to 64. Or D, elderly people 65 plus.
Elderly.
Elvis. Adults 35 to 64. Okay.
I think young adults.
Okay.
Adults.
Okay.
Yeah.
Go with B.
B. Okay.
I think C.
Plus.
I would say B.
B.
Young adults.
Young adults.
D.
D.
C.
I'll say 19 to 34.
All right, so we have 1A, 4 Bs, 4 Cs, and 1 D. What do you think the correct answer is going to be? You ready? Okay, the correct answer is going to be young adults, 19 to 34. And here's why. Texas has the highest uninsured rates in the U.S., hovering around 17.4 to 17.7 overall as of 2023, potentially rising to 18 to 20% in 2025 due to recent policy changes. And by the way, we went over this in episode number 1, so if you haven't watched that, I recommend you go back and watch it. So let's zoom in into adults aged 19 to 64. The uninsured rate is about 21.7 as of 2023, nearly double the national average. Among all age groups, young adults aged 26 to 34, they have the highest uninsured rates. Kids under 18 are about 11.9. Uninsured elderly folks over 65 have nearly universal coverage through Medicare. They have about 2% uninsured. Young adults often lose parental coverage after age 26, and they might not have steady jobs with employer-sponsored plans yet, while folks on unemployment can face high uninsured rates too. That data points to young adults as the hardest hit group overall. So if you are in this age bracket, it is worth checking out subsidized options on healthcare.gov to see if you qualify. Now let's go to question number 2, shall we? Question number 2. Texas has expanded Medicaid under the ACA or Obamacare. True or false?
False.
Obamacare. False.
False, okay.
Probably true.
True, okay.
True.
Okay.
It's false. I think false. False.
False.
False. Okay. Next.
True.
True. Okay. All right. Question number 2. What do you think? True or false? So this is a very loaded question. The correct answer will be false. But what does this even mean? Medicaid expansion. All right. So Medicaid, let's start with learning what Medicaid is. Medicaid is a government program that gives free or low-cost health insurance to people who don't make much money. It's like a safety net for doctor's visits, hospital stays, and medication. But what does this expansion mean? Back in 2010, the ACA or Obamacare, they gave states a choice. They could expand Medicaid to cover more adults. Again, 19 to 64. The cool part is that the federal government, the US government, pays about 90% of the bill to make it easier on the states. But Texas' choice, they said no thanks. It is one of just 10 states that still hasn't done it, even though there were talks and bills in Texas as of early of 2025 to try to pass this expansion. As of July 2025, nothing has changed. But what does this matter? Without this expansion, a lot of low-income adults in Texas fall into the coverage gap. And I'm going to show you a slide so you can see what that is. That means that they make too much money to qualify for regular Medicaid, but too little to afford insurance through the marketplace or the Obamacare. These folks might skip doctor's visits or end up in debt for medical bills. Why? Because they have no insurance. If Texas did expand, more people could get covered, and it wouldn't cost the state much of anything because Uncle Sam picks up most of the tab. Now, let me show you these 2 slides. The first one that I'm going to show you, it will show you the monthly incomes allowed for Medicaid eligibility. Again, this information, you can find it at the Texas Health and Human Services. So let me show you this. All right. So what is this gap? What are they talking about? The first box over here. One second. Okay, the first gap, the first box, this right here, this is the maximum monthly income allowed for Medicaid eligibility. This is how much you can make in order for you to qualify for Medicaid. And I'm going to make it easy so that you guys don't get confused. If you are a family size of 2, 1 adult, 1 children, in order for you to qualify for Medicaid, you can make $196 a month. That is the limit. Or you can make $2,352 annually per year. To qualify for Medicaid, this is the limit. The gap, what we're trying to explain to you, that there's a gap, that will start at the next dollar above these numbers. So we're saying 23. So I'm using my mouse here. 50. 23.53. If you make $1 more above this, that you're pretty much out of Medicaid. You don't qualify. As a family of 2, obviously there's more options. So what is the next best thing, right? 23.53. What is the next best thing? show you this. Okay, here we go. Sorry. So the next best thing, what is it? Obamacare, obviously, right? A family of two, in order for you to qualify for Obamacare, you need to make over 150. Okay, so let's put that number here. $21, one. So if you make $1 less, you don't qualify. So this would be the coverage gap right here. If you make $2,553 a month to $21,149 if you are a family of two. This is the gap that we're talking about. I hope I hope you guys were able to understand what the gap that we're talking about. If you fall into this gap, you don't qualify for Medicaid and you don't qualify for Obamacare. Okay, again, the gap. What is the gap? This is the low income group, no coverage, and marketplace subsidies. So if you make 0 to 34%, you will fall into Medicaid. Here you have no coverage. Here you have coverage through the marketplace or Obamacare. Distribution of adults of 19 to 64. Here we go, 41.8% of 1.4 million adults are currently in this gap. 41.8% of that 1.4 million people are here in Texas. And then this is what I was talking about. Uninsured rates, 19 to 64, 1.4 currently in the coverage gap, 1.3 currently eligible for marketplace coverage. In Texas, there's a total of 1,148 in the gap, 570,000 people, and people who qualify for Obamacare, 578,000. If Texas would expand Medicaid through the ACA, that's what we're talking about. It will eliminate the coverage gap. All right, so traditional Medicaid in Texas covers very low income groups. As I show you, it will cover parents earning about 17% of the federal poverty level, roughly about $5,400 annually for a family of three in 2025. And ACA Marketplace, again, subsidies will kick in about 100% of the federal poverty level. It's about 15,650 for an individual, 26,650 for a family of three. People below this level aren't eligible for those subsidies in non-expansion states. Now let's move on to question number 3. Okay, next question. Do pregnant women qualify for Medicaid in Texas? Option A, no, pregnancy doesn't count. Option B, yes, automatically. Option C, yes, but only if your income is low enough. Or option D, only if you are a U.S. citizen.
I would say C.
Okay. I'm not too sure. I guess I'd go with D.
D? Okay.
I'll go with C.
C.
I'd say income low. If your income was low, I would say.
Okay.
Only if you're a citizen. B.
C?
Okay.
All right, question number 3. Again, very important question. What do you think the answer is going to be? The correct answer is going to be letter C. Yes, only if your income is low enough. Texas Medicaid for pregnant women provides coverage for prenatal delivery and postpartum care if your household income is at or below 198% of the federal poverty level. Household size typically includes the pregnant person and the unborn children. For example, a single pregnant woman expecting one baby counts as a household of two. These limits are based on monthly gross income before taxes or deduction. If eligible, coverage can extend up to 12 months postpartum as of 2025 updates. Below, I'm actually going to show you the website where you can go. Again, it's Texas Health and Human Services, and let's see that. Okay, so I'm going to share the screen. Here we go. Again, this is the Texas Health and Human Services, Medicaid for pregnant women, and CHIP. What will this be covering? Medicaid for pregnant women includes the full array of Medicaid services, while both programs cover services like prenatal, doctor's visits, vitamins, labor and delivery, checkups, and other benefits for the baby after leaving the hospital. And these are the income limit. Here we go. Family size of 1, 2, 3, 4, and 5. Income limits for, here it is. And this is very straightforward. You can go to the website. It's also in Spanish. So if you would like to know if you qualify, if you are pregnant, and if you would like to know if you qualify, again, yes, you qualify, but the income has to be very, very low. And also you can click on here to qualify for that, for this service. All right, let's move on to the next question. Okay, so I'm going to share the screen. Here we go. This is the Texas Health and Human Services, Medicaid for pregnant women, and CHIP. What will this be covering? Medicaid for pregnant women includes the full array of Medicaid services, while both programs cover services like prenatal, doctor's visits, vitamins, labor and delivery, checkups, and other benefits for the baby after leaving the hospital. And these are the income limit. Here we go. Family size of 1, 2, 3, 4, and 5. Income limits for, here it is. And this is very straightforward. You can go to the website. It's also in Spanish. So if you would like to know if you qualify, if you are pregnant, and if you would like to know if you qualify, again, yes, you qualify, but the income has to be very, very low. And also you can click on here to qualify for that, for this service. All right, let's move on to the next question. Okay, question number 4. Do you know when open enrollment is? Option A, October 1st to December 31st. Option B, January 1st to March 31st. Option C, November 1st to December 31st. Or option D, November 1st to January 15th.
C.
You're gonna say C? Okay.
That one I don't know, but I'll go B. January 1st to March.
Okay.
I believe it's C, if I'm correct. I'm not sure.
Okay. Probably C.
I'll go with C. Say D.
D? Okay.
November the 1st to December the 31st. Say A.
Okay. A?
October to December.
October 1st to December 31st.
All right, question number 4. What do you think the correct answer is going to be? Let's see. So a lot of people really don't know the correct answer, and it was a little bit alarming to me because this is something that I feel like everybody should know when to apply and when you are out of that window, but let me go through it. The correct answer is going to be D, November 1st to January 15th. The open enrollment period for Affordable Care Act, which is the marketplace plans, is your main window to shop for, enroll in, or renew. Also change health insurance plans through the healthcare.gov. For coverage effective in 2026, it will run from November 1st until January 15th in most states, including Texas. If you enroll by December 15th, 2025, your coverage will start January 1st. But if you enroll by December 16th until January 15th, it will kick in February 1st, 2026. So I wanted to show you guys that, and I'm also going to show you an illustration about it. Here you go. So open enrollment, when does it start? November 1st. So you can see here, November 1st, open enrollment starts. That is the first day that you can enroll, renew, change through Marketplace for the coming year. December 15 is the last day to enroll or change plans for the coverage to start in January 1st. Okay, coverage starts January 1st for those who enrolled or change plans by December 15. And obviously you have to pay the premium. Open enrollment ends January 15 is the last day to enroll or make changes to your plan for your Obamacare plan. After this date, and when will that start? Coverage will start for those who enroll in this and this plan in February 1st. If you enroll by after February 15th, it will start after January 15th, it will start February 1st. That's what it's saying. All right, last question. What happens if you miss the open enrollment period for the Obamacare or the ACA? A, you can sign up anytime. B, you can't get coverage unless there's a life occurrence. C, you're fined by Texas. Or D, you are automatically put in a state plan. You can sign up anytime?
All right. I think you're fine by Texas. Yeah, I think you're fine.
State plan.
I believe you can sign up anytime.
Let's see.
Okay.
I'll go with C. Yeah, I'll go with C.
Okay.
I would say A.
Okay.
You're fined by Texas. A.
Hey, okay.
Probably it's C.
All right, last question. What do you think the answer is? I know I give you a little bit of a hint, but if you miss the open enrollment period, what's going to happen? You can't get coverage unless you have a life event. Open enrollment is your main window for marketplace plans. If you miss it, you're out of luck, unless something big happens, which is something like losing your job, getting married, having a baby, divorcing, or moving. That would open a special enrollment period, usually about 60 days long. No fines anymore. The federal penalty ended in 2019. And Texas, they won't auto enroll you in anything. So you need to plan ahead. Let me show you this. All right. If you miss the open enrollment period, what are the life changes, right? Certain life events like losing health coverage. So if you lose Medicaid or children's health insurance program like CHIP coverage, that's a special life event. Moving. So if you move to another place, you actually can apply outside of this window. Getting married, having a baby, adopting a child may qualify you to enroll or change marketplace health insurance plans outside of the yearly open enrollment period, which is November 1st till January 15th. If you lose Medicaid, or Children Health Insurance Program, which is CHIP, because your income is too high or other changes, you may be to make you ineligible, you may qualify to enroll on a marketplace plan through a special enrollment period. All right. A lot of information. How did you guys do on the quiz? Whether you aced it or you learned a lot, the key takeaway is that health insurance in Texas can be tricky, but knowledge is power. So let me leave you with this last note. Open enrollment, remember, is from November 1st, 2025 until January 15, 2026. If you enrolled by December 15, 2025, your coverage will start January 1st. Otherwise, it is February 1st. If you have any questions, you have any stories about navigating the Texas healthcare here in the Valley, Houston, Dallas, San Antonio, Austin, drop us a line at the OG podcast at ozulgroup.com or go to ozulgroup.com to schedule your individual needs consultation. Thank you so much for tuning in. Stay healthy. And Texas, I'll see you next time. See you later.
It's like